Welcome to Muscle Research Review for the week of March 23rd, 2015. Quick research summaries for the very busy health and fitness professional. So let's get started. This first study is going to be relevant for those that prescribe exercise programs for patients or clients suffering from chronic tendinosis. The study looked at the effects of repeated concentric and eccentric contractions on tendon blood circulation. They took 11 healthy males and subjected them to repeated concentric and eccentric contractions, consisting of 5 sets of 10 maximal voluntary contractions of the plantar flexors. The measured oxyhemoglobin, total hemoglobin, deoxyhemoglobin, and oxygen saturation of the Achilles tendon. Oxyhemoglobin and total hemoglobin increased after eccentric training, but not concentric. Deoxyhemoglobin decreasing during both eccentric and concentric. Oxygen saturation was greater for the eccentric versus the concentric exercises. This increase in blood circulation from eccentric contractions further supports the benefits of concentrating on eccentric exercises for chronic tendinosis. This next study did a comparison of chronic low back patients' hip range of motion with lumbar instability. As you may recall from last week, another study found that hip extension was the main direction of limitation in those with low back pain. This new study looked at 69 patients with chronic low back pain and divided them into a lumbar stability and instability group. Lumbar stability was assessed by having the patient perform a single leg stance test, a ball test that had them sitting on a gymnastic ball with arms folded across the chest, assessing the passive accessory intervertebral motion test, the passive lumbar extension test, and the prone instability test. They found that hip range of motion was significantly reduced in the instability versus the stability group, and the instability group had greater limitation versus healthy people. The primary limitations were in hip joint extension and internal rotation, further verifying the impact of back pain on hip extension. The next question is, how do hip exercises affect treatment outcome for those with lumbar instability? The study separated 78 patients into the lumbar stability and instability group. For the stability group, 25 were assigned hip exercises, while 20 were the control. For the instability group, 22 did hip joint exercises, while 11 were control. Both exercise groups also performed lumbar stabilization exercises in addition to hip exercises, while the control group performed only stabilization exercises. Treatment was provided over a 6-week period. Here's what they found. All 4 groups showed a decrease in low back pain intensity. Now, the hip exercise group showed a significantly greater reduction in pain intensity levels. The hip exercises were as follows. For a range of motion, open chain hip joint exercises using slings were used and performed for about 20 minutes 3 times per week. For hip strengthening, the groups used elastic bands fixed to their ankle and progressed over the 6 weeks from standing, sitting, and sitting on a gym ball. All these recent hip studies definitely point to providing and implementing hip range of motion and strengthening exercises to a chronic low back pain program, with better results seen in the instability group. This new study asked the question, what's the best angle to strengthen the supraspinatus muscle? A previous study noted that the best single angle to be at 60 degrees. The current study decided to take a look at ranges rather than one specific angle. 40 individuals were assessed using ultrasonography at abduction angles of 0 to 30, 30 to 60, 60 to 90, and 90 to 120 degrees. The results showed that the cross-sectional area of the supraspinatus increased in all angles, but the greatest change was between 60 to 90 degrees. This may be the most effective range for supraspinatus strengthening exercises, and further confirms at least that 60 degrees angle of the previous study was right. Our final study looks at the influence of position and forced respiratory maneuvers on spinal stability muscles. Bridging exercises are the most commonly prescribed exercises to increase spinal stability muscle strength. This study looked at whether increasing the strength of the respiratory muscles would have any positive effects on spinal stability. The study involved 33 healthy subjects performing quiet breathing and 4 different forced respiratory maneuvers: lip breathing, diaphragmatic breathing, combination breathing, and respiration muscle endurance training. They looked at muscle activation in both standing and sitting to ensure the results were not mainly due to postural demands. The study found that the respiration muscle endurance training induced the greatest activation of spinal stability muscles. The results were the same regardless of position. Therefore, subjects with difficulty maintaining a standing posture can actually start a spinal stability program sitting with respiration muscle endurance training. If you have any comments, leave them below. Also, make sure you subscribe to our YouTube channel for the latest weekly muscle research findings. Thanks, and see you guys next time.